Hello everyone, and welcome to Your Health, Your Choice. I am Dr. Roopnarine, and we are coming to you live from our studios at ACTN. On tonight's program, we're going to push on discussing some more topics in the field of mental health. Back in studio with me tonight is Mr. Ferose Abdool. Mr. Abdool is a psychotherapist and family counselor. Mr. Abdool is based at the Gulfview Medical Center in Laramie. As usual tonight, our numbers should come up at the bottom of your screens, and we'll do our very best to answer each and every one of your questions or comments during the program. So guys, it's not an easy topic tonight. We're going to discuss some more topics in mental health, particularly the field of depression. But we're going to get it done, and let's say hello and welcome back to Mr. Ferose Abdool. Ferose, welcome back.
Robin, it's always a privilege to be with you, and you make my life so easy as a great host.
You're very welcome, Ferose. So Ferose, this sort of field on mental health, discussing mental health topics. I mean, you were a guest 2 shows back, and we had a good rapport. We put out a lot of information. The people responded. People were calling you. People were calling the studio. However, it's not an easy topic to engage a viewing audience, right? I mean, let's be realistic. People put on the television to be cheered up, not really to hear about depression, right? So, but we're still doing it, and we're putting out a show on depression. We're going to talk about depression. So my first question to you, why should our audience tune into this program tonight? Why is depression important for them to hear about?
So, Robin, let's get some history on this.
Yeah.
The World Health Organization for several consecutive years until recently had as its theme for Mental Health Day, there is no health without mental health.
Right.
Now, if you ask an average person, what's the status of your health? They would say, I have no sugar, no pressure, no heart problem, so I'm healthy. But when you consider that each one of us is made up of 4 compartments, body, mind, spirit, and then there's a social part of it, right?
Yes.
Unless all of those are working together and are healthy, you really cannot say you're healthy. It's like a jigsaw puzzle. If it takes 4 pieces to make a jigsaw picture, and one of those pieces is missing, you cannot form the picture. So that's one reason that we should really talk about it. The second reason is that if you look at the statistics, if you look at all medical problems, the number 1 on the top of the list, most common, is depression. So we want to understand that. I'm talking about not psychiatric problems, I'm talking about medical problems.
All right. So depression is one of the most common medical illnesses.
Right. The second thing is, if you look at psychiatric disorders, depression again is the top of the list. So that's another reason. The third reason is that 1 in every 4 or 5 persons out there has a depressive disorder. 1 in 4 or 5, Robin. This is mind-boggling, you know. And that's why we need to talk about it. Because there are a lot of people who are listening, probably sufferers of depression, or has someone in the family who is a victim of depression. Right?
So I think you put forward the case really well as to why the viewers should stay tuned and watch the program on depression. But so, I mean, 1 in 4 persons in Trinidad or worldwide?
Worldwide.
All right. Is depression more common in Trinidad than in other countries?
We don't have the statistics to tell about that, but when you look at the statistics I gave you the last time, that 60% of people with chronic disorders are depressed clinically. That is significant. It means if you have 100 patients who are coming to your clinic for sugar, pressure, and heart, 60 of those will have a depression that requires treatment. So that is significant.
All right. So what I'm very conscious of, Ferose, right? When we say, when we say something like mental health and we talk about depression, it still seems like a very abstract sort of diagnosis, an abstract thing, and that's sometimes very hard for the audience or for the viewers or for the patients to understand. Right? It's not like a cut where you could look at a cut. It's not a broken hand where you could see a broken hand. So can you, at your very best, try to describe or tell us what is depression?
In psychiatry, there are many ways of dividing mental health issues.
Yeah.
We can talk about brain damage.
Yes.
We can talk about thought disorders like schizophrenia,
yeah.
where it affects their thinking.
Yeah.
And then you come to something like depression, which is a mood disorder.
Okay.
So it affects the way you feel. And that is essentially what depression is. It affects the way you feel.
Right.
So you don't feel happy, you feel sad, you feel unappreciated, you feel dejected, you feel empty and lonely, you're tearful, you feel nobody loves you. Eventually you may contemplate suicide. So those are some of the possible ways that affect your mood or presents.
Right. So depression is a mood.
It's a mood disorder.
All right. What is the impact of depression on the person and on society at large? Like, what is the impact of depression on the person and the family and the community, really?
Okay.
That's more
when one understands how the patient feels.
Yes.
The patient, for example, cannot sleep, Robin. There are three problems there. They go to bed, toss and turn, and can't sleep. Yeah. Can you imagine what it feels like for you?
Yeah.
You go to bed, you fall asleep, you wake up 1, 2 in the morning, and you can't fall back to sleep, and everyone in the house is sleeping. Or thirdly, you sleep through the night, next morning you're still tired. In terms of appetite, for example, you either lose your appetite or you're overeating and putting on weight and then create other medical problems and so on. Then you feel empty, you feel deeply lonely, you feel that no one really cares for me, you feel helpless and hopeless, and of course then you see what's happening. Nothing is working for you. You're unable to perform at home, you're unable to perform at work, you're unable to perform in school, so that your whole life system now goes down.
Right. And that obviously impacts the people around you, your family, your community,
everything. Of course, because you become short-tempered as well.
Yeah.
So you find you and the wife, the husband and the wife always getting into trouble. Yeah. The kids get into trouble. And don't remember, kids can also suffer depression. Huh?
All right. But we'll go into that a little bit later on. So real practical tips, right? How would the community or how would the family recognize that someone is depressed in their midst? How would you do that? You
will notice a change in the person.
Yeah.
Someone who is normally cheerful and easygoing and happy now is withdrawn, not mixing with anybody. They normally look like certain shows or games. They're not interested in that anymore. They don't want to have friends anymore. They're giving up on their friends. They're telling you in the morning when it's time to go to school, I'm not interested in school anymore. If they have to go to work, they're not wanting to go to work anymore. Their performance is dropping. For young kids as well as adults, they may start drinking and smoking and so on to cope and help them to manage with everyday stresses that they feel. So those are some of the ways in which you could tell that something is amiss, something is happening with this person.
Right.
And the idea is not to diagnose them yourself,
of course,
but to recognize this change and then just to engage the person and find out for yourself, because you would have had a good relationship with that person, what's going on, and then eventually it's to get them to see a specialist, a therapist, meaning someone like a psychiatrist or a family doctor.
Of course.
Or family doctors are well trained in order to make that diagnosis.
Yeah. And how would someone, a lot of people live alone.
Yes.
Trinidad, people are really busy nowadays. It's not like years gone by where we have lots of family meetings and family together and so on. How would someone on their own, who live on their own, how would they recognize in themselves that they are depressed? Because they might think like that's just normal. How could someone who's alone recognizing themselves that they're becoming depressed?
This is very trickish because they lack insight.
Right.
They may not recognize what's happening because you see depression often doesn't come overnight. It's over a period of time and then it becomes norm for them. So in their struggle, this is the norm for them. So it takes someone from outside to see a change in this person, such as we've mentioned earlier on, to be able to then try to reach out to this person, engage that person. For example, every morning you will see this person going out the road for a newspaper. Suddenly you notice for the past few days he's not there, he's not coming anymore. Normally you see a person taking care of himself. His hygiene and so on is good. He's have a nice clean t-shirt. Suddenly you see he's dressing in rags or his t-shirt has not been washed for a week. So you notice those kind of visible change that you would notice because you cannot notice what's going on in their heads. But you could notice as a result how it's impacting on their behavior and so on. Right.
So it really is, a lot of times what you're saying is not really the person recognizes it in themselves, but it's external recognition.
That's right.
how do you move someone? Now, the biggest complaint that you would hear a lot of times in medicine, right? So somebody will always be like, Robin, you know, so-and-so is depressed and in a very low mood, but I can't get them to come and see you.
Yeah.
And I'm like, well, no, you have to get them to come and see me. I know, but like you don't want to see anybody. You don't want to see a doctor. You don't want to talk to nobody. Now, that's a real common dilemma that people face in society. You have somebody at home, a family member, a friend, you know that they need help. You trying your best to reach out to the qualified medical professional, but the person themselves does not want to see the medical professional. How do you bridge that gap? What could be done?
Okay, first of all, we must not give up on our brothers and sisters, Robin.
Yeah.
We need to engage them.
Yeah.
Right? And by engaging them, you may help them to shift from a state of denial into accepting, look, I think I'm okay, but if you think I'm not okay and you want me to see a doctor, I'll go with you. Just to please you, I'm going with you. And that's what we want to make.
Right.
The second thing is that in psychiatry, there are staff now in community mental health who will go home and do a visit.
Right.
So as a member of the public, you can go to any clinic in any health center where there's a psychiatric clinic and report to them that my neighbor, my friend, or someone I believe is not well. And can someone come and see this person?
Okay.
So the law provides for that.
Right.
And if the person goes home and determines that this person is so unwell that the person is a risk to himself or herself or to someone else, then that person can have what we call issue and apprehension order to be picked up and taken to the nearest psychiatric place of safety where they will be observed and a decision made as to whether or not this person needs to stay there until they feel well enough and then go home and continue as an outpatient in the psychiatric clinic.
Okay, so that's really useful tips that you give the public there, and that's really for extreme cases.
Yeah.
And for those who are not extreme, you're saying just maintain the constant being there for them.
Yeah, and sometimes, Robin, by the relationship and the rapport you build with them, they may be inclined to listen to you. So if you say, as I said, often it's just Robin, I don't think anything is wrong with me, you know. But if you think I should go and see somebody, because we are good pals, I'll go with you.
All right, so typically the depressed person, Ferose, in my experience, right? And let's just say that, I mean, I have friends who have been depressed, I have patients who have been depressed. It's a very common, colleagues as well, it's a very common illness. But the first thing they would do is say, Ferose, I don't think anything wrong with me, you know. I think something wrong with you. Well,
that's what they tell us all the time. Even in the patients in St. Anne say it's the staff that need the help, not us. You see, so right?
Probably right too. So what is that? What is that diagnosis? How could you classify that? That sort of response that people give you.
By the time they reach that point, is almost psychosis.
Is that what? Is that deflecting or?
No, that they have no insight.
Denial, total denial.
Is more than denial. Is a lack of insight.
Right.
And that's to tell you the depth of despair and the level of illness that they have.
Right.
They really need to really start on therapy. And sometimes you may, on occasion, get a doctor to visit in psychiatry. I know it happens. But these days, you know, it's a bit risky to go out there, so my colleagues don't like going to do home visits so often. But if you can get a patient to agree at least to come, they don't have to go to hospital. We don't like to mention the name Ward 1. So we say, let's go to the local health center.
No,
it's a much more friendly place.
Now let's really hit that issue there head on, right?
Right.
Because sometimes the fear or the stigma attached to psychiatric hospitals or the stigma attached to St. Anne's, I mean, let's be real.
Yeah, for sure.
And the stigma attached to Ward 1 in San Fernando General Hospital, sometimes that stops patients or stops people who are sick from getting medical help.
But Robin, it stops the family too, you know. It's not just the ill patient. Family don't like the taboo that my brother, my sister, my father was in Ward 1. So they may be reluctant too.
But there's a consequence to that taboo too.
Yes, of course. but Robin, sometimes we are so hung up on prestige and how the public will perceive us and so on that sometimes takes precedent. So what we are saying to them, then go to your family doctor. Robin, all family doctors that I know of, and they are all of them, they're very, very capable, well-trained and competent to diagnose depression and to treat depression.
Right. So let's just say that I agree. And even those patients who have a larger, more significant mental health illness, we just want to talk to the public out there, to the viewers and to society, to break down that stigma about psychiatric hospitals and psychiatrists and hospitalization, because that stigma could cause someone to get very, very sick, not get the help that they need, and possibly a disastrous outcome. Whilst if they did get that in-house treatment at some time, they could actually, they get better, they return to life as best as normal. Sometimes they make full recoveries and get back to being productive members of society.
Well, the key, Robin, is to try to pick up someone early in their illness.
Right.
When they would probably recognize that I'm not feeling my normal self.
Right.
I am not sleeping well. Sleep problem is the most common problem by these patients.
Right.
I am not feeling too good and so on.
Right.
So what you may want to do at an early stage, they don't need hospitalization.
No.
They can be treated by a general practitioner or by a psychiatrist outside.
Right.
And Robin, I'll tell you something. 90% of the patients I treat for depression don't need medication.
Good.
They need simply counseling, because that's another fear that they have.
Good point. Yeah.
Right?
Good point.
They need medication.
All right. So that's going to push the conversation a little bit further along, Ferose. How now? I mean, I still have a significant pediatric population of patients, and a lot of my patients now too as well. They have grandkids and all that.
Yeah.
How would grandma and them recognize depression in children?
Okay.
Because sometimes granny come in and say, Robin, the grandson not himself. I feel he taking on the stress from home, or I feel he taking on stress at school, and it's hard for everyone, grandma, even myself, to know whether this is just it's like, I know if the kid that's feeling a little down, or is this a depression, if it's a serious depression,
Okay.
And sometimes it's hard to engage the kid to get that response back. So I want you to give grandpa and grandma at home some tips to look out for, and ways of seeing that their grandson or granddaughter might be depressed.
Okay. So let me put it this way, Robin, and I'm glad that you brought the subject up.
Yeah.
Because if you look at suicide, which is often a consequence of untreated illnesses
I'm talking about young children.
No, yes.
Yeah.
You think that suicide does not occur in young children, Robin?
No. But
worldwide,
I'll bring it to other categories afterwards, but I'm talking about young children.
Okay.
Yeah.
Worldwide, 4 million young children attempt suicide every year. 4 million. Out of that number, 100,000 succeed at suicide.
Wow.
And one of the common causes is depression.
Of course.
Now, depression in children often presents differently than depression in adults, and that's what you're asking me.
Yes.
Now, with an adult, they will tell you they're feeling down, they're feeling low, they don't want to go to work today, and those kind of things.
Yeah.
I feel a sense of despair, they may cry a little bit and so on.
Yeah.
With kids, it is different. The kid will take a stone and throw it at the principal's car windscreen and break it. The kid will kick the next kid in school. They will take a ruler and hit somebody. And that's how kids with depression, often with a lot of anger and hurt inside of them, and that's how they present. Right? They don't know. They have not lived before. They have not learned how to reflect their feelings, right?
And express their feelings.
Right? So it comes out with a lot of rage and anger and so on. A child who is suddenly rude to the teacher. Normally is very courteous and kind of easy. Dean in the class, right? So those are some of the signs. The child is not waking up on time for school. The child's hygiene is poor. You have to ask him to go to the bathroom 6 times and he still does not go. The child says, I am not going to do my homework today. When you notice changes in your children that are significant, Robin, you need to take note. Right? And you need to get the help that a child really needs. They suffer, Robin, they suffer. I had a young boy who was referred to
sorry to interrupt. That reminds me, like the saying of the older people, there's no bad children. And it's true, isn't it?
No, there's
no bad kids. The kids are behaving bad in inverted commas, because they're not happy. Yes.
I saw this 12-year-old boy who came to see me. And I was chatting with him on a one-to-one in my office. And he said to me, Mr. Abdool, I wish I had a gun, I said, what do you want a gun for? You like hunting? Just to make it light. He says, no, if I had a gun, I shoot myself so that my parents don't realize that they would live to regret, because they are the ones who have me where I am. When I chatted with the parents, Robin, I realized where the child's depression was coming. And that is the mommy mommy and daddy were fighting every day. They had marital issues that they were not dealing in the right way. And the poor child was caught in this and became depressed and withdrawn. And so on. So that we as parents, we need to be very mindful of how we interact and the impact it can have. Disastrous impact and consequences on the little children at home, Robin.
All right. First, we need to take a little break. So when we come back, we'll talk a little bit more on the different patient categories and the different characteristics of depression. All right, guys. So we're going to take a quick little break. My name is Dr. Roopnarine. I'm here with Mr. Ferose Abdool. I'm speaking very much in depth about depression tonight. And I'd just like to formally invite you after the break to send in your questions or your comments or your opinions and your suggestions, and later on in the show we'll read it out and we'll get into them. All right, guys, we'll be back in one moment.
Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
ACTN The Voice launches a new and versatile culinary series called Stacy's Kitchen.
Hi everyone, welcome to Stacy's Kitchen. And on today's episode of Stacy's Kitchen, we will be cooking up a Thanksgiving feast. Our rolls are ready and looking yummy. Nothing like a good curry chicken and some basmati rice. So I'm gonna start putting my wings in to fry.
We will showcase how to make tasty international cuisine with our local products. We emphasize meals on a budget with our selected ingredients.
Restez à l'écoute, Stacy's Cuisine. Au revoir.
So you can put how much, depends on how big you want it. So our fish is ready. Oh my God, look at that. Oh my God, oh my God. Just like paratha, this is lovely.
Join us on ACTN on Monday evenings at 6:30 p.m. Don't miss Stacy's Kitchen, exclusively on ACTN The Voice.
All right, guys, welcome back. We're here with Mr. Ferose Abdool, and we're talking about depression. I'd just like to, again, remind you to send in your questions and your comments and your suggestions if you so wish. Ferose, just before we went to the break, we were discussing depression in kids, in younger kids. If you could tell us what are some of the features of depression in the elderly?
Okay, so when you look at the average person, that's the middle-aged, the young, healthy person, depression presents as we discussed. When you look at kids, we've just said that they are different than in adults. Now, we're talking about depression in the elderly person. With the elderly person, it is very important to pick up depression, and it's also very easy. You notice a change in their normal behavior. You know that nanny gets up at a certain time every day and she does certain things. Suddenly you notice that nanny is not getting out of bed anymore. You notice that nanny insists that before she goes in the kitchen she would have a shower every morning. That is not happening anymore. Notice that nanny will prepare breakfast, but this morning nanny is not interested, and it's not one day. This is repetitive, right? She's showing no interest. She normally will want to play with the grandkids, for example. She doesn't seem to have the energy anymore. Now, those things can be as a result of physical problems, as you know, Doc.
Of course.
But it could be also that it's telling you that there is some change taking place. It's better to inquire and to observe what is really going on with nanny, because as she's getting older, remember, she's getting to a different kind of mental illness too, probably senility or something like that. So you need to be mindful of that. And you know, the funny thing is, Robin, we talk about getting help for people. Help for depression is easily available, and we'll talk about the treatment and management of depression.
All right. So for us, that's recognizing depression in the community, right? What causes it? Why does someone get depressed? What are the causes of, and what happens to somebody that makes them depressed? Because sometimes life is good, they're going around doing their business, doing that, and then suddenly, the slang term for it is being stuck in a rut, you know what I mean?
Yeah.
But sometimes it's a little bit more severe than that. What happens?
Okay.
What causes that?
So, Robin, today we're talking about neuropsychiatry, meaning some things about the brain, the structure, the way it's made, and the way it functions that may impact mental illnesses. Now, we know that certain types of mental illnesses, we see certain abnormalities in the brain that can tell us now. So if you want to diagnose through brain scans now, it can guide you, right? But with depression, we've not yet reached over there. What we do know as far as the brain is concerned, Robin, is that there are chemicals in the brain that we call neurotransmitters. These neurotransmitters really help the brain to function efficiently and effectively. When these transmitters are working well, we don't have a problem. If, however, they're not working well, we start becoming unwell, as we say. Depression is one such illness. Let me put it this way. You know the gears of a car. They need to fit in and mesh to work well, to turn the engine, to turn the wheels. When they are slipping, we say the gear is slipping. It's not working. And that's essentially what happens. And that's why they put the patient on antidepressant, for example, to help those chemicals to get back to where they need to be, as they need to be, the right levels to function. So those neurotransmitters or chemicals in the brain is one.
So you're saying basically depression is a chemical problem. It's a reduction in the neurotransmitters. And the function of medication such as antidepressants is to maintain that chemical. But what causes that chemical to deplete? Do we know? It just happens?
We don't have all the answers yet, Robin. Now, there are other risk factors that put the patient at risk of developing depression, such as genetics, meaning that if you have a close family, mom, dad, brother, sister, your kids with depression, your chances are statistically higher than if there is no such person in your family with depression, right? So genetics is another risk factor. Then you have drug use. We're talking about alcohol, marijuana. I want to repeat marijuana, cocaine, heroin, and those groups of drugs can create the risk. Then we have certain medication that is a good doctor you will prescribe to treat medical problem like diabetes, hypertension, and so on. Even depression and mental illness that carries a risk of making some patients depressed. And that's why, Robin, I know when you prescribe an antidepressant, you will ask the patient to come back in a couple of weeks. Let me review your medication and see how you're doing on it. Right? Because you don't give them 3 months at that point in time. You give them a couple of weeks. They may have allergic reactions too. So you want to call them back and see how they're doing.
That's a very important point.
And then, of course...
And not only with antidepressant medication, but a lot of medication.
Yes, of course.
Sometimes people think you take, especially for antidepressants or medication, people think that you take the tablet and that's it, problem gone. That ain't so.
Well, Robin, I'm glad to have this conversation with you.
That ain't so. And sometimes medication is a course. Right? And that's the hard stick sometimes, because sometimes the effect of these medications don't reach the effect for sometimes up to a month, sometimes up to 2 months before it really takes hold. And they have what they call the therapeutic level.
The therapeutic window.
Therapeutic window of medication. And that's frustrating for patients. Because you're taking a tablet for about 10 days and you're like, well, nothing happening. But it really is about a patience, it's about compliance and sticking with it till it reaches that therapeutic window.
So Robin, I'm glad you mentioned that. I was going to do that, but let me just emphasize, to emphasize the point. If you have a headache, you take 2 Panadol, in an hour, your headache gone. With depression and certain antidepressants, quite rightly, it may take an average of 4 weeks for the patient not to get better, but to begin to feel better. And so they need to continue. And I'm glad you mentioned that, Robin, because many people, if they take medicine for a few days and they feel better, they stop it. And they may change their doctor too.
And they would say the medication not working.
Of course, right? And so it's important for them. And it's important for them to understand a few things about antidepressant, Robin. For example, even when you feel well enough, you cannot stop your medication. The doctor will decide when is the best time for you to do so, and then the doctor will taper your medicine, cut down the dose over a period of 2 to 4 weeks. If not, you will get withdrawal effects, in which case you can become much more depressed than when you started your medication, even suicidal at that point in time. So it's important important for patients, and hear this, Robin, their families who accompany them to the doctor to get this information. Because often the patient is neither here nor there in terms of how they're thinking and so on. They're unwell, their minds are not with them, right? So that they need someone to guide them and to make sure that if you miss, let's say you take your morning dose at 8 o'clock. If 9 o'clock comes and you realize I didn't take it, please. Don't miss your dose. And next day you continue taking it at 8 o'clock. That's important.
So, it is important. And I'll tell you something there, Ferose. So the two major things that I see with patients with depression, one is, as I mentioned earlier, is actually getting them to get the help. Right, to actually getting somebody to go and see a psychiatrist or the doctor, whoever. That's a big challenge in the community, and you kind of address that. You know, there's people who are able to come home, you stick with them, you don't give up on them, just keep at it, and help will come. And then the second part of treating people with depression, which is very difficult, is that a lot of the time the medication goes flying out the window. And pharmaceuticals are a big part of treating depression. But what you have just explained is the rationale why the pharmaceuticals should not go flying out the window, and why it's so important to take the medication, because we can't have people who are diagnosed as depressed and not taking the medication prescribed by a doctor.
They're not going to feel better, Robin. No different than patient with high blood pressure and diabetes. If you visit their homes, Robin, you see the shelves like they have a pharmacy at home. And they'll go religiously to the clinic every month and collect their medication and leave it on the shelf.
So the next part of helping these people, I mean, we brought them to help, and we actually get them to comply with help. But you first, your role, what do you do for depressed patients when they come into your office beyond medication? What else is important for their recovery?
All right. So psychotherapy is another word for counseling therapy. Another simple word is talk therapy. So we sit with our patients, we develop a rapport with them where they can now feel comfortable with us, and that's take a couple sessions sometime, Robin. Remember, they're strangers, literally, right? And they want to be able to trust you, to share with you a lot of very personal and sometimes intimate information about themselves, about their lives, sometimes about relationships at home, sometimes about the kids and so on. And sometimes it's not easy for a patient to come suddenly to a strange person and share all that kind of very private information. So once you've built that rapport with the patient, Robin, the patient will now start talking about what's going on in their lives. Because remember, still there's an element of shame and so on associated with it, you know. So they won't want to share that information with you.
And then also, I mean, in Trinidad especially, just as we said, there's a stigma attached to people going to psychiatric hospitals, right? You are not a psychiatrist, you are a therapist. Right? Now, in the States and in Europe, I mean, it's quite common for people to visit a therapist because they take that as part, not quite common, but it happens more frequently than it would happen here, because people take that as part of their wellness. This is me making sure I don't get sick by visiting the therapist when I have an issue or a problem like early depression. But in Trinidad, I still feel, I mean, we're getting better, but I still feel there's a little bit of a stigma attached to that. Is that true? Do you feel, you're the man in the field.
No, absolutely right, Robin. And I feel that not enough emphasis is placed. I'll tell you, Robin, you as a general practitioner, not you personally, don't realize the power you have with your community and your clientele. Because you have been with them over many, many years, sometimes the grandfather, the mother, the kid now. And you would have built that reputation where you could say to the person, listen, I understand what your problem is, but that is a little bit out of my area of expertise. And because I have a special relationship with you, I want you to get better, I would like to refer you to a colleague who provides that service. And now in that trust that you build with the patient will say, who is that doc? I will go and see the person.
So you do agree that there's still a little bit of hesitancy by the public?
There's a lot of hesitancy. And Robin, let me also say to you, the hesitancy is not from the patient alone.
It's from our colleagues as well?
Yes, our colleagues as well.
That's fine, because they probably don't understand the role of the therapist. So I interrupted you to make that point, but I want you to continue on. What after you've built the trust with the patient in your consultation room, and they've discussed the issues which you have discussed, why they are depressed, what further happens in a therapy session?
So one of the reasons why the patient has failed and has now become ill is that they have not really developed or learned coping skills. So you help them to develop coping skills by understanding their background, where they come from, how they have learned to deal with issues and problems, Robin. And you can always see a history behind this?
Yeah.
Where this has happened? Have they been taught? Have they learned how to manage different issues and problems? And for example, I could tell you kids that were literally pampered and not allowed to do anything for themselves, not allowed to make decisions for themselves growing up. As they grow older, they have challenges, even in dealing with relationships in the classroom, Robin.
Right.
So it's important for parents to bring them up. So we look at them and we ask them.
And this is called coping skills.
Yes. How do you cope with stressors? Right.
And coping skills, you're saying coping skills is something that you could learn when you're growing up as a kid.
Of course, Robin.
Right.
You learn from the time you were born how to cope, how to manage. When you want milk, you cry, right?
Of course. It's just a real passive, a passive learning process.
Yes.
And then sometimes when they become adults, and if they don't have coping skills, you can learn it as well.
Of course, it's a skill like every other skill, Robin. You learn it. And basically, Robin, let me tell you that the psychotherapist, the counseling specialist really only helps the patient to recognize in the patient the capacity and the ability they have to deal with their own problems, Robin.
All right. So for us, when people come to you and go like, for us, I can't deal with this. I don't know how to deal with this. And then you try to show them that, hey, because you've lived life, you have these skills that you're not aware of.
That's right.
And you bring out those skills in them?
At least at that point in time when they're knocked down on their backs, as Robin, they're not aware of it.
Right.
And then you talk to them, okay, so in the past, when you faced similar situation, how have you managed it? How did you deal with it? And they say, well, right, So this is like peanuts now.
It's like Rocky. It's like Rocky 3.
Right?
Yeah, you get knocked down and then you come up to them and you talk to them and you tell them, look, remember you got up before.
Right.
You got up before. What you did to get up before.
So all the patients often need, Robin, is for you to praise them, reward them, recognize them, not to treat them like dodos, as they say.
Yes.
Patients are persons no different than you and me.
Of course.
It's just that they're on their backs right now and they need someone to hold their hands and walk with them, someone they can feel trust in, somebody who they can share their problems without feeling that they will go and talk about it to somebody else, which is important, Robin.
Of course, confidentiality.
Of course, because I make sure that before I talk to relatives, I ask the patient, would it be okay for you?
I mean, that's a given.
And most of the time they would agree, Robin, because I want to win the family as part of the team. Because remember, I would only see a patient for 1 hour, Robin. The patient goes home to his family. They're there with him 24/7. They have to work with him. And I would also call them to thank them and praise them for the tremendous job they are doing to look after the patient home, Robin.
All right, so I don't want to hammer you right down now.
No, that's okay.
Into what are those coping skills? I mean, give the audience those coping skills that could help them get over hard times. What are they? What are they?
You identify the specific problem or challenge that they have. For example, the death of a loved one, Robin. It's not an easy thing for somebody to get over. And it may be associated with a lot of, for example, in reflecting, they feel guilty, for example, I should have done this, I could have done that, and so on. And you get and you walk them through that process, and they realize, Robin, not you, they realize. You see, when you get them to realize it themselves, it's like me fishing for them. I don't want to fish for them. I want to teach them to fish. Right? Because if I fish for you, I give you just one meal. If I teach you to fish, I give you food for life. Right? So you help them and you walk them and show to them explain to me what's been going on. Right? How do you feel? You give them the option because you want them to feel good that they have achieved this. What do you feel your choices are? And of the many choices you have, good judgment is choosing the right one. The one that would work for you is the right one. Right? And you get them and you walk them step by step, Robin. And through this relationship that you would have built on the fact that they know that you will guide them rightly, they would work with you. Patients are very, very easy to work with, Robin. But they have to know that you are professional in what you do.
First, we're going to take our next break.
Sure.
And when we come back, we'll go through a little bit more.
Sure.
All right, guys, so we're going to take our second break. Again, just inviting you to send in your questions and your comments, and we'll deal with them after the break. All right, guys, we'll be back in one moment.
ACTN The Voice welcomes you to join us for our newest agricultural television series, Harvest.
Welcome to Harvest. We're doing it double again, north and south. This morning we start here in Brazil Village on Bethany Estate with Michael and Jacinta Mill.
You can look forward to a personalized tour around scenic Trinidad and Tobago, showcasing different agricultural practices and teaching us self-sustenance.
So Wendy, you're about to show me your bromeliad house.
Yes.
Oh, this is lovely.
This is what our customers refer to as the Mecca for bromeliads.
Explore the many ways to make your harvest right for you.
So our chicken coop is more or less built at a height whereby it's easy for us to go and just remove the wood shavings into our barrow.
Now, you don't plant out your seedlings, you buy the seedlings, right?
Yes, we purchase our seedlings.
Here we are on a not quite monocrop site, but we have rows of tomatoes, rows of sweet peppers, and then you have the Milnes polyculturing.
Join us every Tuesday at 6:30 p.m. Harvest, a new dimension in agriculture.
Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
All right, guys, welcome back. We're here with Mr. Ferose Abdool, and we're talking about depression. All right, so we hammer it down into some real take-home pearls, advice, some solid material that you as viewers could use to help those other people in the community. We're not talking around the subject. We're not describing depression. We're giving you real tools that you could use to heal. All right, Ferose, before we went on the break again, we were talking about the coping skills, right? It's a and you're saying coping skills a lot of times are choices, and right. You as a therapist, you guide people to make the right choices. But very importantly, what we didn't discuss is what are the causes of the depression? What are the stressors? How do we manage that? Okay. That is part of your coping skills too, because you need to cope with the stressors that are causing depression. Right. So if you could just give us a list of the stressors, the common stressors, and how they could cope with that.
All right, so I have a list that I developed, Robin, that I want to share with our viewers.
Yeah.
First of all, something simple as moving house.
Yeah.
You know how stressful that is for a person.
I've been through it myself.
Right.
Yeah.
Secondly, divorce or separation.
I haven't been through that one, but I heard it's
not just stressful for the couple, but for the kids involved in that process.
Of course.
For example, you moving your home, for example, Robin.
Yeah.
Your kids would have a relationship with the neighbors. Yeah. The neighbor's pet, for example, and you are moved now. Suddenly, the kids packed up and they're going somewhere in a totally different area.
Yeah. Let me just tell you something there for us. Being a GP as well. Yeah. For many years. One of the things that I recognize, kids get depressed and get sad and not well and complain and come in. And they like to come into the office because when they come into our office, they're treated special. Right. They're given priority. And I recognize that is the problem. Sometimes kids are not given priority when they're home with their families.
Thank you.
When decisions are made about life. Yeah. Nobody asking them.
Right.
They're not being heard, they're not given priority. And that's why sometimes, despite some of the parents might be like, oh, they're going to give an injection in the office. A lot of kids love coming into the office. Yes. Because from the time they open that door in the clinic, the guy behind the counter is, hey, how you doing? They're given immediate priority. Yes. And that's why kids sometimes love going to school too. Because as soon as they open the door to go into the school, the security guy like, hey, how you going, princess? How you doing? They're given immediate attention and priority. What they want.
Criticism, Robin, and less criticism.
And less criticism. And I'm sorry to interrupt you, but that was a very simple way to explain to the audience that sometimes kids don't feel very happy because they're not given priority at home.
Absolutely, Robin.
Right, so you can continue on.
Righto. So death of a loved one.
Yeah.
Now, that loved one, Robin, I see kids, for example, who are very depressed. They come from school. One of the boys in school was knocked down or stabbed and killed.
Yeah,
and I asked him, so this boy is your friend? Not really. He's in a class? Not really. So how do you know him? He is from my school. I've never seen him, but he's from my school, which is from his community, Robin. And he's affected by that. So, you know, as parents, we need to be very careful.
That's his friends.
That's his friend. That's
his social network.
Right. So that's another one. Chronic alcohol or other substance abuse. People don't realize that alcohol may make you feel good for a while, but used over years and years, Robin, it has really bad effects on you, one of which is depression. The other one is certain medications, and we spoke about that before. Medications are prescribed to, we said earlier on, dissatisfaction at work or in school and so on. Now, Robin, not every child is bright as the daddy or probably mommy was. And very often they are being criticized, or you have to be like your brother, or you have to be like your sister, and they are criticized and made to feel that they are unworthy. They should be given recognition as an individual and to praise them for their achievement. Robin, if my kid makes a C, but I believe that's his best effort, I am cool, you know, Robin, right? But if I think that you could do better, then we need to find out why you're not doing better and help you.
Of course.
Not just critique you, right? All right. Widowhood, the passing of a spouse, for example. Chronic physical illnesses is another risk factor. You have serious injury to the patient or to somebody they love. A victim of abuse, Robin. We missed that one. It's important. Crime or incident. I see a lot of young kids, Robin, who have been abused by, of course, usually family members, close friends, and so on. Low self-esteem, loss of job, and we spoke about that on our last topic, Robin. So there are a number of things that can put people...
It's an extensive list, but you've hammered the ones that are relevant to Trinidad and our community, and I appreciate that. But for us, we have to take a little bit of feedback from the audience, from the community themselves. And Josh, you have some comments that were sent into your questions. Hi, good night. Good night, viewer. Isn't it true that depression can also show up as aggression in adults as well, not only children? Ferose?
Yeah, absolutely correct. That caller is absolutely right.
That view is absolutely
but by and large, it's the kids who are unable to express their feelings and their emotions and how they feel deprived or depraved, that it will be presented with anger and hostility. But adults can also present that way.
Because we have adults who can't express themselves in words either.
Absolutely.
Because they haven't. Why is that? Why is that we have why is it that we have people in society who can't express themselves?
Robin, because they have not mastered the skill.
The only way they express themselves is to fight.
Yeah. They have not mastered the skill.
Even adults.
Yeah, and they have not mastered other life skills like negotiation in relationships, negotiating with family members, negotiating at work. Because that word negotiation means learning how to work with people.
Yes. Interact.
Yes.
And that's a learned skill.
Yes, of course it's a learned. That is nothing innate, really. That's nothing genetic.
And for us, when you're treating people with aggression, because people with aggression might come into you that's a problem they have. I mean, they might fess up and say I have aggression. What do you teach them? How not that? Do you teach them those negotiation skills?
What we call anger management skills.
Anger management.
Anger management. And that is very simple. And I could teach you viewers tonight one time. First of all, admit how I feel. If you're feeling happy, wouldn't you admit you're feeling happy? So if you feel angry, admit I feel angry. Secondly, you try to explore why you're feeling that way. In other words, trying to discover what's behind it. Why do I feel angry really? Right. Thirdly, is to find an alternate way to express that anger. For example, take a run, read a book, look at a show, do something else, exercise, do something. And lastly, when you have done that, Robin, just dump it. Many people carry it, Robin, and they carry this burden, which is like an anchor on you. All it will do is to sink you.
That last piece of advice was excellent. Because a lot of problems in the world, and societies, is by people carrying on bloody baggage from
long time,
from even not only themselves, from generations going back and all kind of.
Absolutely, Robin. So learning how to dump it is really very important, Robin. Because I'll give you a good example, Robin. If you are vexed with me, trust me, I will walk out here and smile. You will leave this place and go home, Robin, with a very heavy heart and a lot of stress on your head. So forgiving is not about the person who's hurt you. Mostly, it's about forgiving yourself.
All right. Josh, you put up the next question there. What do I do if I'm worried about my mental health? Ferose.
All right. If you're concerned, Robin, sometimes I have very senior professionals who would come and say, boy, I went and I get my checkup, my stress test, my blood test, and so on.
Yes.
I really want to check my mental health. When you sit with them, Robin, you realize that they have concern about specific aspects of the mental health, or that they're having difficulties, for example, in their marriage. They won't come and tell you that right away, right?
No.
But then you discover where this is coming from, and you can engage them and then help them with the issues that really burdens them.
Right. So I mean, the key part of it is basically just reach out to your medical professional, to your healthcare professional, your mental health professional. Josh, you have any other questions there? How do I deal with someone telling me what to do?
Well, it depends on who that person is and why they want to tell you what to do. Who is the boss? But often it's a gameplay there, Robin, right? And people need to know
a gameplay
between the two people we're talking about there, right? Somebody who's talking to you and telling you what to do. You have to be very careful of people in doing so who are trying to control you, and I suspect that is probably what it is about.
Maybe that's what they are getting at.
How to control you. If a person is controlling you, very often these people are very insecure in themselves, Robin, and the way they manage theirs is by controlling somebody else, right? So that person needs help, and if it's a couple, this couple should come out to deal with the couple's issue in that is presenting as a controlling behavior. It's not healthy behavior at all, Robin. The moment you feel you have to control somebody so that you could feel good, something is wrong.
Now, I mean, I'm very cognizant that we're running out of time, right? But how do you recognize, how would somebody who's being controlled by somebody else recognize they're being controlled by somebody else? It's just that they tell you do this, do that.
In very sometimes
as that viewer is alluding to.
Sometimes in covert ways, Robin. They don't necessarily come and push you around. But the way they treat with you, you get the feeling that this person really wants to control. Even my mind is what they will tell you.
So that means that the person who is being controlled loses their sense of self-esteem,
self-worth, self-value.
Self-value.
And people tolerate that very well but after a while, Robin, they come out and they say, listen, I've given, I don't have any more to give anymore.
And that's it.
Right? And that's it.
That's it.
They end up in the courts.
Josh, any more questions? Josh?
Which treatment program?
Which treatment program should come first, mental health treatment or substance misuse treatment?
Well, this is why substance abuse clinics are usually run by mental health personnel. Usually, they're well qualified, and the way it's done is they treat both of them side by side. In other words, together. You can't say to them, let me treat your substance abuse and then come and treat your depression. They are both one and the same thing. Your substance abuse may be the reason why you are depressed, and vice versa. Or they can be two separate illnesses that you have coinciding with one. Right? So you don't treat them separately.
You do it at the same time.
At the same time. So that you'll find in our substance abuse clinic, for example, at Southwest, you have psychiatrists who is the senior person there, with mental health officer, the social workers, and psychologists. They all treat the person totally.
My little thing there, I think substance abuse treatment is not recognized enough. It's not. People need to understand that there's help. But it's not advertised enough. I don't know, it's not in people's consciousness where the help is. So could you just tell people where they can get help for substance abuse problems?
For sure, Robin. You can go to any community health service where there's a psychiatric clinic run, public health service, where there is a psychiatric clinic, and tell them, listen, I think I may have a problem. Could you please direct me where I can go to? But if you want to go directly, in San Fernando, next to Naprima Bowl, there is a substance abuse clinic there. You go to on a Monday, anytime after 8, and tell them what your issue is, and they may give you an appointment. When you go and you see the team of specialists, they will interview you and take you from there. It's a very efficiently run clinic.
So this is a walk-in, walk-off the street clinic on a Monday in San Fernando.
A Monday in San Fernando.
All right, guys.
Next to Naprima Bowl. Next to the Cancer Treatment Center, the same building. That's where it is. And you go and tell them what your issue is. And trust me, Robin, it's very private. It's very confidential. Nobody will know except you and the staff with whom you engage.
All right, good. Josh, any more questions there? Great topic. Thank you very much, viewer. Thank you. My question is, can OCD also be an indication of depression? Obsessive compulsive disorder.
Yes. The thing about psychiatry, Robin, many conditions can coexist, meaning they can exist in one person. For example, OCD, depression, OCD, schizophrenia, OCD, bipolar disorder, they can all coexist. You can have them. And that's why it's important. The key to treatment in mental health, Robin, is proper diagnosis.
Right.
Right? Once you're diagnosed, that's in general medicine the same thing.
Of course.
Right?
Of course.
You have to get the right diagnosis, and then you can treat the condition.
So there's an overlap of conditions.
Oh yes, for example, 40 to 60% of patients who are depressed also have anxiety disorders.
Of course, it's something we do hand in hand, anxiety and depression.
And even the scientists recognize that, and that's why now many a time you find drugs that treat depression also treat anxiety.
Yeah.
Like those drugs that you mentioned before.
Yes,
they treat depression, anxiety, OCD, panic reaction, a wide range of them. One tablet.
And they're all related to each other.
Yes.
So anxiety is a form of depression?
Well, it's not a form of depression. In the old days, we used to call it anxiety depression.
Yeah.
But now we say that a person is clinically, you present with one or the other.
Okay.
So they say you have a depressive disorder, but you could have anxiety with it, right? And the doctor treats you symptomatically.
Right.
If your symptoms are predominantly anxiety, they treat you with some anti-anxiety medication.
Right.
With depression, they treat you with antidepressants.
All right. Josh, you have another question there. Let's take it. What are the non-medication methods for treating mental health symptoms? Ferose?
Well, I just alluded to the fact that 90% of the patient I see with depression, I treat as psychotherapy or counseling.
Yeah.
Right? But then you have other things that must go with it.
Yeah.
Whether you take medicine or psychotherapy,
by the way.
It is, for example, diet, exercise, meditation, visualization, relaxation, music therapy. You know, those are the things that you also include. In other words, there's a holistic approach to the management of your condition, Robin.
Can you just repeat them there again? Slowly.
Exercise. Diet. Relaxation. Meditation, visualization.
What is visualization?
Visualization is where you get yourself into a position where you can think clear. And then you try to imagine yourself where you would like to be. So you're visualizing. It's like looking in the mirror.
So you visualize yourself having good health?
Yes, where you want to be.
You visualize yourself not being depressed?
Right. Yes, because that's where you want to, that's where the drive and the focus are going to be, you know, the end result.
So it's like having a clear goal.
Yes, exactly. That's what
visualization is having a clear goal.
That's what it is.
And after visualization, you said music therapy.
Music therapy. Then you have to choose the music therapy that will help you, Robin.
What do you mean by music therapy?
It could be, some people, for example, prefer flute music.
Tell them relax.
Yeah.
And they help you feel better.
That's right. Right, Robin? Just like if people don't sleep, they have problem with recovery, right? So the same thing with these kinds of therapy. For example, you get social interaction, occupational therapy. You know, in the old days in the psychiatric institutions, and they still should do, they have an occupational therapist who comes and engages the patient in a very creative way that is used diagnostically, but also to help to rehabilitate the patient to go back home. So some, for example, the wives who have forgotten how to cook and so on, they have stove and they help them to show them step by step how to prepare a meal. So when they go home, they are rehabilitated. That is what we call it, rehabilitation. Right?
First, we've come to the end of the program.
Already?
Yeah, boy. Very interesting. I learned a lot.
So do I.
We have a big long list of questions that we had here. We didn't cover 3/4 of them, but that's the nature of where the discussion took us. And me seeing very important points that I needed to just slow down and bring out to the population. And that's what I must compliment you on, because you didn't just talk about the topic, because anybody could read up on the internet about depression, right? Anybody out there could read up about the internet about depression and mental health. But I think the real fact that we really related to Trinidad and Tobago, and related to our community, and you give them information that is not on the internet or not in the books, but that comes from experience.
Yeah, well, I prefer to go with my experience plus the things that I learned from other people, including my patients, Robin.
And it's not that only; it's simple things that are in the forefront of everyone's consciousness. But when we just brought it out, and we give them some practical tips on where to get help to. We give them practical tips on how to recognize it, how to bring the person towards help, what happens when we're giving people help, and how to rehabilitate them.
So, Robin, in ending, let me say to you and to our viewers that depression is a very debilitating illness.
Yeah.
But when it's diagnosed early and treated appropriately, the treatment rate of success is very, very high. Our so-called cure rates are very high. You need not spend the rest of your life being miserable or reaching the point where you feel you need to hurt yourself or get into trouble, Robin.
Very good, very good. Well, we didn't know that.
Yeah.
All right, guys. So, thank you very much for tuning in. Thanks a lot to Mr. Ferose Abdool, and thanks to Josh in studio for helping us with this production tonight. All right, I am Roopnarine, Dr. Robin Roopnarine, and we're signing off for tonight. So, everyone, please have a pleasant evening. Take care of yourself. Keep well, and we'll see you again next week. Take care, everyone. All the best.